Welcome, everyone. I'm delighted to be joined by Dr. Jennie Milnes today, a senior psychologist working in an adolescent inpatient, to talk to us about adolescent mental health and depression. Jennie, thanks so much for joining today.
Hi, Susan. Lovely to be here.
Yeah, great. Thank you. So what we might do is sort of dive straight in, if that's okay. So firstly, maybe starting to think about what factors that you see are impacting on mental health of adolescents today.
Yeah, I suppose it's important to start by saying that adolescence is a very unique phase of life. So there are very rapid changes that are happening, and they are physical changes, obviously, with the onset of puberty, emotional changes, and psychological changes. So I suppose physically you have puberty and hormones that make a big change to how people experience the world. And then socially, young people are very much separating more from parents at this stage of life. So with that, you become more autonomous. So young people are developing a sense of their own identity, and they're asking questions about who they are relative to kind of who their family of origin are. And with that, there's a lot of excitement and possibility, but there's also an awful lot of pressure. And I suppose if you think about how that struggle with identity sometimes manifests, it might be around, sorry, I won't say struggle, I'm going to say playfulness around identity. Yeah. So people try different hair colors or different styles or different haircuts, etc. And with that, there can be quite a bit of pressure. So the kinds of things that can impact an adolescence that maybe are different from those in early childhood in terms of mental health are experiences of bullying at school. Young people and children also become more aware of any family stress or difficulties that might be happening. So, for example, if a parent is stressed or depressed themselves or struggling in any way, if there's maybe relationship difficulties at home, if there's stress around housing or homelessness, that can significantly impact on mental health. And I suppose what I often think about in terms of resilience to mental health difficulties is, very often we can manage maybe one thing at a time, but it's when we have multiple stressors happening at the same time that there is more risk. So, for example, if a young person is transitioning to secondary school and there might be bullying or relationship difficulties, and maybe it's someone at home loses their job, or there's instability around housing, or crucially, if an older sibling might go off to college, or the family might lose a grandparent. All of these little things can add up when they're put together to lead to significant stress and strain on mental health.
Yeah, there's a huge amount going on, isn't there, when you think about it? I suppose there's the kind of, as you're saying, the routine changes maybe of psychological, social, emotional, and navigating that identity through that, and then maybe kind of additional stressors, isn't there?
Yeah.
As you say, like then the things that might kind of go wrong at home or in terms of work or bullying at school or something. Yeah, I guess, I don't know about you, but kind of from my vantage point at this age, it's hard to remember in a sense all of the turmoil and the turbulence of being a teenager, isn't it? And that's just when things are kind of on track, isn't it? That's like there's enough to be getting on with when things are sort of going as they probably will be, but not when there's extra stuff thrown in.
And I often reflect on that because I'm reminded of this because I work with adolescents in my day-to-day. It helps me to remember that they are experiencing all of these things for the first time. So, a relationship and a relationship breakup, or a change in where you live, or realizing that mums and dads get sad and stressed too. All of that is happening for the first time. And with that, combined with the hormones, it's like everything feels huge and really, really big. And that's a very sobering reminder for me a lot of times, that I'm able to sit as an adult and go, oh yeah, that's happening again, but I've experienced that before, and so I have some skills. So if you think about people trying to cope with something for the first time, typically we don't have our coping skills for that for that thing yet.
Yeah.
And so it's kind of navigating that for the first time.
Yeah, that's such a good point, isn't it? Because I guess you build that resilience. That first breakup is much harder than the fifth or sixth, isn't it? As you say, you develop that capacity to respond to it as you go through those experiences. That's a good reminder, isn't it, for kind of adults watching, that it is the first of all of these experiences. And I suppose people talk about it a lot, don't they? But I definitely feel the world is very different now, in 2023, with all the kind of additional societal stuff going on that might have been different maybe to 10, 20, 30 years ago as a teenager.
Yeah.
So I guess that must be kind of playing a role as well. Um, and I guess maybe then thinking, I suppose, our kind of Aware Mental Health Week, thinking about depression across the lifespan, and what you think about what depression sort of does look like for adolescents.
Yeah.
Is it, I guess maybe the thing that people might be wondering watching this is it different, or is it the same as adults or as kids? What do you think?
I suppose I think what's unique about adolescence and depression in adolescence is that I think depression looks very similar to how it would in maybe an adult or an older adult. However, because your teenager is growing and changing and there's lots going on, it might be that what they're experiencing is the normal kind of mood swings or difficulties that are associated with puberty and adolescence.
Yeah.
So for example, one of the symptoms of depression can be for that someone might sleep an awful lot, but we know that for teenagers that is quite normal.
Yeah.
So I suppose again, what you're doing is you're looking out for a combination of factors. And you're looking out for a combination of changes that concern you, but that last over time. So you might notice your young people, a young person kind of grumpy or irritable. Again, that could be hormones and puberty.
Normal.
or something more.
Yeah.
You might notice them sleeping a lot or complaining of not being able to sleep. You might notice that they are finding it difficult to concentrate. You might notice that they are maybe withdrawing from activities that they used to enjoy doing, or that they're declining going to social events. You might notice that there's a significant change in their appetites. They might be eating an awful lot more or an awful lot less. But I suppose I would say, if you feel that something is off, trust yourself and don't be afraid to ask. So we know that a huge protective factor for mental health across the lifespan is relationships, and good quality relationships. That's the same for our teenagers as well. So, don't be afraid to ask just innocuous questions. How are you doing? Or how are you finding school at the moment? Or I noticed that you haven't wanted to go to your football for the last few weeks, or just those little things, so that you're keeping up the connection. And a teenager being a teenager they might not even respond. They might just kind of grunt at you and walk away. But the important thing is that you keep on trying and you keep the line of communication open. So I don't know if that's answered your question, Susan, in terms of
No, definitely has. No, I think it's really important, isn't it? Because of course depression is going to be a similar-ish experience, isn't it? But I suppose, as you say, there's something about knowing you're a young person, because sleeping loads is very normal. And like relentless eating for some teenagers is also very normal, and they're not eating that much. So that I guess maybe it sounds like the really key thing that you're saying is trust your gut and know if there's a change that's kind of persisting. So we're not just talking about a weekend of being in the room or something. And I guess that's, as you say, there's something important too about asking the question of, you've not been to football, or X used to call around and they're not calling around anymore, and it seems like you're not doing as much. Obviously you'd worded it a lot better than I've just worded it there, but there's a kind of a curiosity, isn't there, as you say, is like, how are you getting on generally? And you might get nothing back to that, because it might just not feel like the right time for the young person to be able to say it, or not feel able. But I guess you're saying that it's what you're doing is holding a space that if they can take it up at some point, it's available for them to kind of talk through what might be happening. Because I guess there can be a lot of shame and stigma as well for young people. Isn't certainly kind of this Instagram sort of idea, like you have to be happy and popular. And if your life doesn't look like that, you know, are you allowed to kind of tell anyone or, you know,
Yeah. And I think as well, you know, it's great that there's a lot of information out there now for young people. Like there's really good websites, including the Aware website, also the Jigsaw website, some information on the HSE website that's quite good, probably more for parents. But I know that a lot of young people, a lot of teenagers will talk about, you know, Googling symptoms. And
yeah,
so oftentimes they can be a little bit worried about
yeah,
themselves. And as you say, because of shame or because of stigma, or just because it's not yet a habit to talk about those more vulnerable parts of ourselves, they're holding that in. So they
yeah,
might have a really good sense of themselves that they are quite down,
yeah,
or depressed, and they just don't know where to
yeah,
bring that. So yeah, so depending on the young person, they will communicate that in different ways.
yeah, yeah. And I guess differently to different people,
Yeah.
presumably as well. Yeah. So I guess it's true though, isn't it? I guess you're gonna have a sense of that. And I suppose there's a lot, not to go on a tangent, but there's a lot of TikTok videos, isn't there, about mental health? And there's a lot out there. So there's something very valuable in what you're saying about trusted sources. If you're a teenager listening to this, or if you're a parent, like do try to kind of get that from the sites that you mentioned, either also Jigsaw or GP, or like it's having those sort of conversations, isn't it? Or getting information that's more reliable, maybe.
Yeah, absolutely, absolutely. And I think, you know, a key thing as well is that, you know, it feels in a depressed place, it feels like it's never going to get better, or it
Yeah.
might feel like this is insurmountable. I won't be able to get through this, and it can never feel different.
Mm.
But depression is extremely common, and for the vast majority of people, it can be a very transient experience, and it can be very well managed. So it can get better. And
Sorry, Jenny, you cut out there for a little bit. Would you mind saying that piece again? Sorry,
yeah,
my
how far did you hear?
just I think just the last two sentences I think I missed.
Um, I think I had said that,
You were just
yes,
saying,
when people are sad, or feeling low or depressed, it feels like it's never going to change, or that it can't get better. But it will get better. And we know that talking helps, and we know that relationships are a great buffer and a great support for people when they're feeling low.
yeah. And I guess maybe it goes back to, as you said, the first time of things. So
Yes.
this might be the first huge experience of depression, and that's really difficult. And you don't know yet the signs and the ways out for you as an individual and what helps you. Like that's yet to be learned.
Yeah.
If someone does go to experience again or something similar. So that's huge, isn't it? So it's really important, as you say, to kind of hold on to that this talking does help, relationships matter, and you do get through it, you
Yeah.
know. That's really key. And I guess then for maybe I suppose for parents and what they might do if they think their kind of adolescent or young person is experiencing depression. I know you were saying, yeah, definitely kind of keeping those channels of communication open. Do you think, I guess I'm thinking about when kind of, and you'd be the expert on this, but whether it kind of it can be difficult for young people to speak to parents, and whether that just maybe doesn't happen, you know, or for lots of reasons, you know, that can be very complex, I think, as to why maybe a young person can't find someone who's trusted. Or so maybe, sorry, that's two separate questions maybe, but
Yeah.
maybe firstly, what parents can do is in
Yeah.
addition to what we've said. Yeah.
Yeah. I suppose I just want to say on that it can be very difficult for young people to talk to their parents about how they're feeling. So it's really difficult to admit vulnerability. But on the other hand, if they have a good relationship with their parent, or any good adult, so we know that you know, from the One Good Adult stuff, that any good adult, whether it's a teacher or a youth work leader or a mum or a dad or a granny, or it doesn't matter,
Yeah.
as long as they have somebody, um I would also, but I would say one of the blocks or barriers sometimes for young people, in my experience, talking to their parents, is that they might be aware that the family are under an awful lot of stress at this moment in time. They might realize that, mum or dad has lost their job, or there's financial pressure, or mum or dad has lost their own parent, is grieving an older sibling going off to college, or something like that. And for those reasons, they don't want to feel like they're putting pressure on anybody by talking about their own needs. So sometimes that can be a block or a barrier. And so I think it's very important to, as a parent, or a carer of a young person, to open the question, because they might not bring it because they don't want to feel like a burden. The other thing that I would say is that there are some really good services out there. If it does need to go beyond the family, and you feel like that the family needs some support, there are local HSE psychology advice clinics. They're not in every area, but they are in some areas. And what parents could do is phone their local primary care centre and inquire. So what you're asking about is there a local, or is there a psychology advice clinic available in this area? And the person who's taking your call should be able to advise you. And those clinics are rapid access clinics to a psychologist. So you can typically see a psychologist within 2 to 4 weeks. Sorry, I'm a little bit distracted by the kitten.
The kitten's arrived, have they?
The kitten has arrived.
Oh, funny.
I wasn't going to get through this without
No, not to worry.
She might do a, what's it called, a photo bomb, or or something.
Well, sure, we know now, so we'll be ready if she does.
Yeah. And just on that note, pets are a great they're great support for mental health, I have to say.
Yeah.
Bring a lot of joy.
Yeah, absolutely.
Yeah, so I suppose your local psychology advice clinic, if there is one, I know on the Aware website there's very good information. The HSE website have very good information, as do Jigsaw. And Jigsaw generally as a service for adolescents are great. They have relatively rapid access, even though I know that they do have some waiting lists. But I would say reach out for support to those places.
Yeah.
A GP is also very good as well. I suppose really from the assessment perspective or a screening perspective, to see whether something is a kind of a transient low mood, or a difficulty that might pass, or whether it's something that needs kind of monitoring over time.
Yeah, that sounds really brilliant, actually. I didn't know about them. So that, so if someone was to ring for that psychology advice service, is that for the parent would be ringing, or the adolescent would ring, or?
The parent would ring.
The parent, okay, for advice on their young person.
Yeah, so typically how those clinics work is that you phone and you will be advised when the next clinic is on.
Okay.
So typically those clinics run either once a month or twice a month, and you'll be advised then to maybe phone back on the morning of the clinic, and you will get an appointment that day. So you'll get a 30-minute appointment with a psychologist that day. And again, that's really helpful because those clinics are nicely bedded into the local community. So it might be that HSE wait lists are very long, but they might say, oh, there's a adolescent counselling service up the road, or there is a club where there is a counsellor, or we know that in your child's particular school there is a guidance counsellor who can be very helpful in this regard. So they're really plugged into the area. Brilliant. And they can kind of direct you. And also if it's something that needs more attention, so for example, if a young person is very down and or they're self-harming, that clinic will be able to organise or advise a referral onto a CAM service. Ah,
brilliant. Okay. It sounds really, really good service then, yeah. So, and sorry, just to get you to say it again. So you could find that out by calling your primary care service, is it? Yeah. Okay. Absolutely. And you can find your primary care service on the HSE website, can't you?
I think so.
Yeah. Do you think, or?
Yeah, I think so. I'm not, the HSE website can be a bit hit and miss. I think they're constantly updating it just because of the volume of services that they have. But I think even, an internet search of whatever your local area is and primary care service, and there should be a phone number that pops up. Yeah, okay, brilliant. I'd say that'd be really invaluable, for people listening. So thanks for that, as well as everything else. In terms of the... Can I sorry to cut across you, because I feel like I might have overemphasized the need for services there. And I
Yeah.
feel like I have maybe skipped over the more important part, which is that there is an awful lot that you can do as well as or before you feel the need to go to reach out to services. And it's back again to that quality of the relationship bit. And I would often say to parents, put yourself in the young person's shoes. So imagine that you're feeling really low or you're really struggling with something. What kind of a person would you like to speak to? Because sometimes what happens for parents is, because it's so emotive to think of your child suffering or in difficulty, parents maybe get a little bit panicked or a little bit freaked out by the fact that their young person is quite down. So the first thing I would say to parents is stay calm and really try to keep that relationship alive between yourself and your young person. Thank you so much for telling me. I had actually noticed that you were a bit down. I'm just so glad that I know now and I can support you. And also remembering again that they're experiencing everything for the first time. There can be a tendency sometimes from our very maybe scathing or cynical adult space to hear some of their worries and maybe to dismiss them. It might be there's been a breakup with a girlfriend or a boyfriend, or it might be that they feel left out, or it might be that they've been experiencing what we would consider maybe kind of minor blips, and that we can then minimize that. So even if it doesn't seem like a big deal to you, I would say listen and take it very seriously, because it's a big deal to them.
Yeah.
So support them in a way that you would like to be supported.
Yeah, I think that's great. Yeah, no, it's really helpful. As you said, there's a huge amount that can happen in that relationship before services, and you're going to know your child or your young person the best, and you're going to know, like, and if you're seeing, so that it's kind of facilitating that conversation, or you'll be in a system that they're known well.
Yeah.
So there's something, I guess, as you say, about a safe space. I know that phrase is used to the nth degree, but it is important, isn't it, that there's a safety in being able to say something, as you say, that touches in on huge vulnerability and is huge and new, and might, on this from an adult perspective, not seem like a huge thing, actually is a huge thing, because it feels like that. So I guess that there's something about validating the emotional experience of it. Oh, this is really, it's very hard, or feeling very lonely at the moment, or very disconnected from people, and how difficult that is when you're 15, 16, 17.
Absolutely.
And that's a really valid experience. And I guess maybe, I don't know if this happens, but also maybe the parents' fear of self-blame or guilt, as well. So maybe the difficulty in opening stuff up, or then feeling that they've done something to this, and I guess probably also fear of something maybe that comes up a lot in other areas, is if you ask too directly about stuff, it might put it in someone's mind. And I guess the reality is, it's quite possibly already, if there's something going on, it's safer, isn't it, to ask? And as you say, kind of, if someone then comes back and says, I have been feeling down, well, thank you for telling me that, I noticed. That's quite pivotal, isn't it? I'm holding you in mind. I'm noticing that things aren't the way they usually are. And that matters to me as someone who relates to you.
Yeah, absolutely. And I think you've touched on something really important there. So parents that I have worked with have said to me, I've tried to approach my young person and I ask them, are they depressed? And they say no. And then they grunt and they walk up the stairs. How can I go back and revisit that conversation? And a lot of the time it is about revisiting. It's about these little moments of connection that happen over and over again. And it might be that you let that lie for a couple of days if your attempts at connection have been kind of flat out rejected by your teenager. And you might revisit it in a quiet moment a couple of days later and say, look, I'm sorry if that upset you or annoyed you when I asked you about depression. And then you might start to notice, you might start to use the language, I've noticed. It's just that I've noticed, you're not coming down for dinner anymore. And I noticed that, you know, when I walked into the room the other day, that you were crying, or I noticed that you didn't go to your friend's party at the weekend. And I suppose I was just worried, and I was wondering, was everything okay? Because I love you and I care about you, and
Yeah.
I just want you to know that I'm here. So you're telling the person what you've seen. You're not necessarily labeling it for them. But you're saying, I've noticed this change or that change in a compassionate way.
Yeah, no, I guess it has to be compassionate, doesn't it? Because it's otherwise it's certainly, if I would imagine, from where young people are experiencing a lot of evaluative relationships.
Yeah.
It you know, in school and all the rest of it, it needs to be from a place of kindness, a kind curiosity, doesn't it? And I'm sure the intention is that, but sometimes our own anxiety can lead to maybe things coming out possibly in ways that we then might think, oh yeah, maybe I could have asked that in a different way. But I guess you're saying you'll have a lot of opportunities to ask in different ways.
Yeah.
And start the conversation in different ways potentially. So keeping it going. I wonder, just on that, maybe then what adolescents or young people can do to support their own mental health, or if they do feel depressed, kind of those kind of self to self sort of things.
Yeah. I suppose first and foremost, I would say have a look at some of the websites, but the reputable ones. So I would say you've really good information, kind of life stage by life stage on the website. Jigsaw have a very good website. Spunout.ie have a very good website, and you can have a look on those around what it is to feel low and what you can do if you're feeling low. I would say talk to somebody that you trust, because it's important. I often say, you know, feelings aren't going to go away if we try to ignore them. They are there for a reason a lot of the time. And obviously, as a psychologist, I think they provide really good clues about what it is that matters to us at that moment in time. And I would be, you know, professionally, I would get really excited if somebody brings their sadness, because I would say, this is we can look at this together like detectives, and what's it going to tell you? Let's not put it away. What's it telling you about what you need, and maybe what might be missing, etc., etc. So I would say talk to somebody that you trust, and you can start a conversation about how you're feeling in a very safe way. So the hardest bit for most teenagers is finding the first words. So choose your person, and then your first words can be something like, and you might want to rehearse them, I haven't been feeling myself, or I'm not feeling okay, or I'm finding school really hard. And take it from there. And if you don't get the response that you want from the first person, go to another person. But do reach out, because we know that talking helps. And it's a bit like untangling a knotted cable or something. If you have a second person helping you with it, or fairy lights for the Christmas tree, it's what always comes to mind when I think of things that are knotted and tangled, and you take it out and you go, I'm never going to be able to do this. It's such a mess. But actually, when you break it down step by step, you can get through it, and you can untangle it. And to say to young people as well, that if you're feeling down, or you're feeling low, it is very normal to feel like that. And there is a way out. So a lot of people can feel that for a particular period of time, and there is possibility for change and a way out.
That's a really hopeful message, isn't it? Like it's and as you say, very hard to hold on to when someone might be in the kind of eye of the storm of a depression. But I guess we're here talking about it, and I guess there's a lot to say that kind of things do get better. As you say, it's maybe the key bit is taking that first step, and that's huge, isn't it, for people. But a really important thing to do, maybe. Yeah,
absolutely. And I know that there are I think I'm not sure actually whether Jigsaw will accept kind of phone calls from people directly, but I know they have a kind of an online chat facility, and I think the ISPCC's Childline have an online chat facility. So there are ways that adolescents can connect in with reputable services
Yeah.
without having
Yeah.
to go via their parents, and then
Okay.
a professional will be able to advise them.
Yeah, that's really helpful, I think. And I think maybe it sounds like what you're saying as well is different ways to communicate as well. So you don't have to pick up the phone, because that can be awful, can't
Yeah,
it?
yeah,
For lots of different reasons. And certainly, yeah. So there, maybe it's a text message or it's some other way to communicate. So you don't have to, and that's a lot safer, isn't it? At sometimes for
yeah,
people. Because I guess we don't want to decide, certainly maybe it's probably important to mention that as part of this life stage, that self-harm and suicide can be part of that for some people. And I suppose it's important to get in early in terms of if things aren't okay,
mm,
to that it's like asking for help is okay, and having those conversations with trusted people to
mm,
get the help. Yeah.
yeah.
And I don't know, Jenny, if it might be okay to maybe just to say something if there is a parent or caregiver or adolescent themselves who are a bit worried about that, what can be helpful if they are having kind of more darker thoughts and things are feeling quite
Yeah,
desperate maybe.
yeah. I mean, I suppose we might talk about that, and we could talk a little bit about self-harm as well, if it's helpful. I know
Yeah,
that that is an extremely emotive
yeah.
subject and topic for parents, and understandably so, because it's really quite frightening for a parent to, for example, if they see a wound or a cut or a mark or whatever the form of self-harm is for that young person. And oftentimes parents can go straight into, because it's such a visible sign of distress, self-harm,
Mm,
and the
mm,
wounds associated with it, they can go straight into an intense fear that their young person might be feeling suicidal or might be intent on completing a suicide. Um, so I suppose what I would say is that first, for any parent who realizes that that young person is self-harming, to take a breath, and to get yourself to a place where you feel relatively calm, so that you can have a conversation with young people. So in my experience of working with young people, what tends to happen is a parent might discover self-harm in a young person, and then they kind of freak out.
yeah.
So there might be a, show me those cuts, and then the young person is getting even more distressed,
Mm,
and so it erupts into a crisis. But I would say, think about self-harm as a communication of emotional pain, and think about it as a coping strategy.
mm,
So we talked earlier and throughout this conversation about how these young people are experiencing really big feelings, really big emotions,
mm,
and really big life experiences
yeah.
for the very first time, and they don't yet have maybe positive coping strategies to deal with that. And self-harm typically is extremely effective at
Mm,
alleviating emotional distress in the very, very short term,
mm,
because
mm,
you are focused on the pain that you're experiencing from a cut. You don't have the capacity to focus on the more longer term emotional pain of a breakup, for example, that you've been experiencing all week.
yeah.
So people do it because it's effective in that moment. The difficulty with it is that it's not going to last. So you
Yeah.
have to do it again and again and again, and very often the effects of it wear off.
Mm,
So it's something that happens, but I suppose we would always encourage young people to try and find different ways to cope. And for the parents, what I would say is try not to focus too much on the behavior, try to
mm,
focus on the emotion.
mm.
Gosh, are you okay? How were you feeling when that was, or just find a way to open that conversation. I suppose what I would always say as well is that self-harm is a spectrum from kind of mild to more severe ways of hurting yourself.
Mm,
And I would say to any young person, if you have hurt yourself in any way that you feel is potentially dangerous, and we would see this a lot in services,
yeah.
if something might have gone too far, go and
Yeah.
speak to somebody straight away, and they will get you to medical
Yeah.
service so that you can get some support. And that's very, very important. And it's important for parents as well to, I suppose, look after the practical side of things. I don't, you know, I understand that you don't want to show me what's happened, but I just want to know, you know, do you think we should just pop into the GP to have a look?
Yeah.
Because I just, so that we make sure that there isn't an infection, or, you know, in case you might need stitches or whatever it might be. But again, you have to regulate yourself very, very strongly, so that you're
Yeah.
able to kind of keep calm in that moment.
Yeah.
And again, yeah, just try to open the conversation about distress.
Yeah.
And where there is self-harm, it's really important to go and see a GP. And if the
Yeah.
young person won't go, that the parent will go, because it is a communication of significant distress.
Mm, mm. Yeah, it's, I guess, as you say, it's an important message, isn't it, that needs to be listened to. Yeah, definitely. And that's tough, isn't it, to regulate your own self? But as you say, crucial,
Very
because
important.
you can't empathize, or you can't hold a space
Yeah.
for someone else if you are incredibly distressed. And not to say that obviously it's going to be normal to find it distressing, but as you say, it's taking a bit of time. You don't have to rush in immediately. There's a little bit of space for you to ground yourself
Yeah.
or to calm yourself, because it's so distressing, isn't it, to see someone else's distress in that very concrete way. So grounding yourself to enable that conversation, and the importance, as you say, of kind of getting both medical help if needed, but also the psychological help. Yeah, so there's kind of a different aspects of it. But as you say, that I think that the thing that's kind of striking me from our conversation is that there is help there. There's things that parents can do. There's things that the young person can do. These skills can be learned, you know, ways of managing big feelings, ways of kind of coping that are more healthy and more self kind of compassionate and loving. They're there. It's kind of getting the person to them and learning them. But they do exist and people do benefit from them. So it's there is a lot that can be done, I think.
Yeah. And I
Yeah.
suppose I would just say on that as well, you know, a young person might not know why they are self-harming. They might
Yeah.
not yet be able to name or recognize or label their emotions. It's just that in the moment they felt something, and then there's this that takes that away for an extremely short period of time,
Yeah.
enough
Yeah.
to give them a little bit of relief. So if you're asking a young person, you know, it's common to asking people, well, why did you do that?
Yeah.
And you know, I suppose it can be frustrating then, and a parent can feel very disempowered if the young person's like, I don't know why I did it.
Mm.
And sometimes young people are feeling very ashamed about self-harm.
Yeah.
So they might know and they might not want to tell you, or they might not know at all. But I
Yeah.
suppose it's just that bit about, gosh, I'm imagining that you must have been, I don't know, feeling something really unpleasant at the time, even if you don't
Yeah.
know what it was, that it was really unpleasant. And I'm so sorry. And I just
Yeah.
want you to know that if you ever feel like that, just come to me, day or
Mm.
night. Let me
Mm.
know and come to me, and we can find a way through. I suppose that's the message we're trying to
Mm.
give young people all
Yeah.
the time, is we, you know, this is hard, and yet we will be able to find a way through. There's always a way through.
Yeah. Yeah, I think it's a really nice message maybe to kind of come to an end with, that there is a way through. And I suppose, as you say, the key part of what we've been talking about today is the relationships,
Yeah,
really, isn't it? And kind of the young person's relationship with themselves, but we're kind of quite crucially at this life stage with trusted other people. Um
absolutely. Yeah,
and there is a way through. And I guess that the kind of lie that depression or mental health difficulties tell us is that this is never going to get better and I'm on my own with it. And both of those are untrue.
yeah.
And I guess so kind of taking or accessing help or support can help kind of come through that difficulty. Yeah. Oh, well, Jenny, this is really, really great conversation. Thank you so much for joining for our mental health week. I think it's been really valuable insights. Apologies for coughing all the way through it.
That's okay.
Uh, but yeah, but listen, thanks so much.
Yeah, thank you for having me, Susan. It's been really fun.
Great. You're very welcome. Thank you.